Shri Gurubhyo Namaha. Very good evening and warm welcome for today's free webinar on case discussion on cardiology with Dr. Shyam Sundar Tarachan sir, organized by Ayurveda Map and initiated by MedMap. On behalf of Ayurveda Map, I welcome you all for today's session. Myself, Dr. Akshita. So before we start off with today's free webinar, I would like to just give you the glimpse of the upcoming courses of Ayurveda Map. So today's free session, a webinar on case discussion on cardiology. So the topic is post-myocardial infarction with respect to Rasayana Chikitsa. So if any of your friends are willing to join the webinar now, kindly intimate them and tell them to join the webinar as soon as possible and make use of this free webinar and discussion. This is a prelude to our upcoming cardiology course, Diploma in Ayurveda Cardiology course, which is a 6 months online training program for BAMS doctors. So as you can see, this is our syllabus. So you can see there are key concepts in clinical cardiology, hypertension management, diagnosis part, the Ayurveda as well as modern part. Everything will be covered in the diploma, and it's a unique specialization which is specially designed for BAMS doctors who are looking for specialization in cardiology in Ayurveda. And sir is one of the eminent faculty in cardiology specialization in Ayurveda, and it's a pleasure to have him as the mentor of this diploma cardiology course. So kindly contact Ayurveda Map to join the course and make the best use of this opportunity. Also, we have a new course, which is a Sthanika Chikitsa and Stri Roga course. So it's a 3-month specialization course wherein you will be learning more than 12 localized gynecological therapies. So hybrid learning will be there. Both online and offline training will be provided. So kindly contact Ayurveda Map to join the course and make the best use of this opportunity. So offline training will be provided at SDM Udupi College. So this is about the Sthanika Chikitsa in Stri Roga specialization course. Also, the second batch, the admissions for the second batch of Diploma in Ayurveda Cosmetology is open, and it's soon going to be launched. And it's a 6 months duration course. Offline training will be provided, and the center is at Bangalore. So it's open for all BAMS doctors. So without much delay, make use of this opportunity and enroll as soon as possible. We also have a postgraduate diploma in sports medicine and rehabilitation course coming up. It's a 6 months intensive program designed for BMS doctors. So mainly you will be learning about sports medicine, and you will be specializing in musculoskeletal health. And so obviously there is a hybrid training. So all the x-rays and diagnosis part as well as the hands-on training will be provided. Kindly contact Ayurveda Map to join the course. Also, we have a diploma in antenatal and postnatal care in Ayurveda. It's a 6 months course for BMS doctors. Again, it's a hybrid learning course. So practicals will be taught. Hands-on training will be provided. Also, it's a university-backed diploma. Certification is also available. So kindly contact Ayurveda Map to join the course. We also have admissions open for 2026 for the course of Professional Diploma in Advanced Panchakarma. So again, it's a 6 months course, and all the recorded videos, live sessions, as well as the recorded videos and doubt clearing sessions and post course support for all of these specialization courses will be there. And eligibility is, of course, for the BMS doctors, and both online and offline training will be provided. So these are about the upcoming courses. So make the best use of this opportunity and pick the specialization course of your choice, and also let your colleagues and friends know about these courses. So moving on, I would like to introduce our guest speaker, Dr. Shyam Sundar Tarachan sir. So sir is a professor, and he's also been principal, and sir is an MD in Kaya Chikitsa. Sir has around 35 plus years of academic, clinical, and administrative experience in Ayurveda. And mainly his subject expertise is in Kaya Chikitsa, Kriya Sharira, and of course, Ayurveda cardiology. Sir has been the founder and course director of cardiology in Ayurveda, so level 1, 2, and 3. And more than 5,000 students have been trained by Sir, and more than 100 plus batches have been completed. He's also guided many PhD students, and he's also presented in many national and international platforms. And he's also the author and researcher, and he has a book. He has published a book, so cardiotoxicity of herbs, and also been awarded with many prestigious awards. So I'd like to welcome you for today's session, sir, and it's a pleasure and honor to have you as a mentor for our diploma course. And we are very eager to listen to you talk about today's topic, myocardial infarction with respect to Rasayana Chikitsa. And over to you, sir.
Thank you very much. Good evening to all of you. As you all are aware about the today's topic, that is Rasayan Chikitsa post myocardial infarction. Today, here we are discussing one case report also, post and pre and post treatment reports I want to share with you. Before going to the topic here, you all are aware that Rasayan Chikitsa is the unique specialty of Ayurveda. If you think about the modern science regarding the geriatrics and all these things, these are very recent branches in the modern science. Some thing which is the tool you are having as you are the Ayurvedic disciple, you must exploit it and think in that way that you can benefit the society and you can benefit the patients also. As far as today's topic is concerned, the tagline here is कार्य कठिन है इसलिए करने योग्य है. सामान्य कार्य तो सभी लोग करते हैं. This is the tagline of the today, and this is the reference I quote to you. The Sri Ranga Avdut Maharaj's quotation I quote for you. In order to boost your moral, you are something special. Your specialization, you are graduate from Ayurveda, postgraduate from Ayurveda. So you are something special, and society is also expecting something special from you. Now come to the topic here. Just a small introduction about the Rasayan Chikitsa. Nowadays, number of the practitioners are also running the Suvarna Prashan for the babies in order to boost the immunity, in order to boost the IQ, in order to boost the memory and all these things. You all are aware. And on every Pushya Nakshatra, those who are exclusively doing the Ayurvedic practice, they are now become the Rasayan Chikitsa for the babies, that is Suvarna Prashan. And you see in the society that this program is successfully run by our friends. Just I'm brushing your knowledge here so that I can immediately reach to the main topic here. रसायन तंत्र नाम वयस्थापन आयुर्वेदा बलकरम रोगहरण समर्थ છે. So the benefits of the Rasayan Chikitsa, Dirgha Ayushya, Buddhi, Balaprapti, Sushruta quoted, Sarvopaghat Shamaniya. As our today's topic, post myocardial infarction. That means the patient had myocardial infarction, that is heart attack. We want to learn the narration, the quote of the Sushrutacharya, Sarvopaghat Shamaniya. In myocardial infarction, the ghat, what the Sushruta pointed out here. So taking into the consideration how we can treat the post myocardial infarction with the help of Rasayan Chikitsa in order to make the circulation. The heart itself requires blood. Due to the infarct, there is a necrosis, there is a dead tissue. Modern science believes once the part get dead or necrosed, cannot be rejuvenated there. I want to show my full faith in the guidance given by our acharyas, and I want to avail the benefits of the Rasayan Chikitsa. There are some conditions, separate chapters dedicated to Rasayan Chikitsa, Charak Chikitsa Sthan, chapter 1-2 dedicated to Rasayan and Vajikaran. Gaining the essence from these chapters, our hypothesis before thinking on the line of Rasayan Chikitsa in myocardial infarction, can we accelerate the collateral circulation can we overcome and put the new life in the necrosed part? And Charka very exclusively mentioned in Krumija Rudroga, the term used by Charkacharya is Sankleda. The site of myocardial infarct where the tissue dies. That is the best environment to develop the krumis at that site, and Charka exclusively use the term Sankleda there. You all are familiar with the term clade when you are exclusively in the chapter of Prameha. But in Krumija Rudroga, Charka very precisely mentioned the term Sankled in order to pointing out the dead portion or the necrosed portion, and that is giving you the best environment to multiply, or that is the best site to have a krumis. They gets multiplied in that site. Charka also mentioned in Krumija Rudroga, that is the bhakshana karma of these krumis. So at this juncture, that is not our topic, but just I pointed out here. Our aim to apply the Rasayan Chikitsa and make the regeneration in the part which is damaged, the portion of the heart, that which portion get dead, necrosed due to the infarction. We want to regenerate it. This is the theme of our today's topic, that is the Rasayan Chikitsa post myocardial infarction. The patient named Liladhar Morarji Bhanushali, age 53 years, had a recent inferior lateral myocardial infarction on 1st June last year. On 1st June, patient admitted to hospital. Complaint was chest pain. Diagnosis was inferior lateral myocardial infarction. Angiography carried out. For second opinion, on 12th June, patient landed to Jaslok Hospital, Mumbai. Once again, on 13th June, angiography and angioplasty carried out. Known case of inferior lateral myocardial infarction. Now, patient willing to start the Ayurvedic treatment. Here, the medicine, the Rasayan Chikitsa we started Suvarna Arjun Prash. How to prepare the Suvarna Arjun Prash and its content that is mentioned in the present slide also. As you are aware, the properties of the Suvarna, that is one of the ingredient of Suvarna Arjun Prash Yog, I highlighted, underlined the properties why we selected Suvarna as one of the ingredient of Suvarna Arjun Prash with reference to Rasayan Chikitsa. सुवर्ण बृहण स्निग्ध मधुर रस पाकयो विषदोष हरम. Vishadosh, that is Amadosh, that is the deposition of the cholesterol. The deposition results in coronary blockages, which in turn results in myocardial infarction. Suvarna is having a Rudya property. Suvarna is having the Lekhan property. Now, here, we are treating post-MI patient. The property of the Suvarna, Vranagna property. Will help you to repair the fresh, in fact, the fresh wound there. The Rasayan property of the Suvarna will help you to regenerate, repair the damage, and at the end, the circulation in that particular dead tissue, that is collateral circulation, or you can say when that particular parts get nourishment, that will get regenerated. You all are aware that the Suvarna is having Ojo Dhatu Vardhanam property. Hruday is a site of the Oj. You are also aware about the Per and Upper Oj. Here today I am not going in detail, but why I selected Suvarna as one of the ingredient as a choice of Rasayan Chikitsa, some points I highlighted here. The details of all these things during the course, that is our one of the point in Diploma Cardiology, there at that time, definitely we will take the in detail knowledge about these things. But today, I try to highlight here, I try to address here which properties. Here are the two different scenarios. One scenario is there is a coronary blockage, and second scenario is post myocardial infarction. There is a coronary block that turns into the myocardial infarction, and I want to avail the Vranagna property, Rasayan property, Oja Dhatu Vivardhana property of the Suvarna in order to boost, in order to blow the new life in the infarcted part. The second ingredient here that is the Arjun. Just I'm once again highlighting on the Suvarna due to the Margavarodh, that is the Amavish, that is cholesterol, that is a metabolic disorder, atherosclerosis. Vagbata mentioned Kaphanubandhi Vatajarudro. Due to the channels narrowing or there is a blockages in the coronaries that result in infarct. So the Dhatu Sangatan,
Excuse
that
me,
is a
sir.
Sira and Mansa Dhatu,
Sir,
that gets,
sorry to
that
interrupt,
gets,
sir.
yeah,
Actually, participants are asking, slides are not moving, sir. There's no PPT, right?
PPT is there, madam.
Okay, we are not able to, I think.
Not from the beginning, you had not
No, sir. No,
visual
sir. No.
this first slide. Can you visualize this?
No, sir. I think you are not sharing the screen yet.
Just a minute. Can you now?
No, sir.
Is it visible to you?
No, sir, not yet.
Oh,
Yes, sir. Now it is. And see the desktops.
now visible to you slide or not yet?
No, sir. Just the desktop screen I can see.
Now visible to you, madam?
Yes, sir. Yes, sir. The first slide is visible, sir.
Yes, yes, yes. Okay, thank you. Sorry for the inconvenience. Immediately, you should point it out. See, our topic today is Rasayan Chikitsa in post-myocardial infarction. I introduce you what is our concept behind this. And here, a patient named Banushali admitted known case of myocardial infarction, lateral inferior lateral wall myocardial infarction here. So we decide here to blow the new life in the dead tissue. We selected here the one of the yog, that is Suvarna Arjun Prashyo. On this particular, you can say the medicine. During my post graduation, I think I'm talking around 1987, 88, 89. I completed my research work on this topic, Suvarna Arjun Prash, at a government hospital there in Ahmedabad. So I am sharing here the formulation also. There is no any secret about this. The secret is only this, that you people come forward and try to do the Ayurvedic cardiology practice. This is our very simple, plain intention. There is nothing we want to hide from you. What you require? You require in-depth knowledge of the Samhita. You require number of patients. You require the knowledge of cardiology. You require the knowledge of the drugs we are using in our day-to-day practice. I'm talking here about Ayurveda, and the specialization here, the unique specialization of Ayurveda is Rasayan Chikitsa. And in Rasayan Chikitsa, today, how I treated the patient and what the results we received, I am sharing only this much thing with you. Considering what is the Rasayan, what are the benefits of the Rasayan, how to give the Rasayan. I had quoted here that number of the Ayurvedic practitioners are practicing on the Pushya Nakshatra in baby Suvarna Prayo in order to boost the memory, immunity, and the in all growth of the babies, all these things. You are aware about that. What are my comments on that topic? Definitely, I will share with you. Today, I am going to give you a one small hint. Go and visit the chapter Chikisasthan. Chapter number 1 and 2 from Charak Samhita is dedicated to Rasayan and Vajikaran Chikisa. Today our topic is Rasayan. Refer to that. Before starting the Rasayan Chikisa, what are the things discussed over there? And one very popular example given by Charaka, if the cloth is dirty, you cannot color it properly. You have to wash it and then color it. When you are giving a Suvarna Prashan to the baby, you must ask the mother whether the baby is healthy. Recent time, within last 1 or 2 days, whether the baby had fever, loose motions, cough. So this general, you have to take the history of the baby and come to the conclusion that baby is a swasth baby. Then you can administer the Suvarna Prashan Yog. Then and then only the Rasayan benefits will pass to the baby. This is my personal comment. How many you people are doing and following this, I don't know. I'm not criticizing anybody. I'm following Charak. Today, just we are running away from our topic. Our drug is Suvarna Arjun Prash, which we administered in our patient post myocardial infarction. Why we select Suvarna? I underline the properties of the Suvarna. Suvarna is Vishadoshahara. I mean to point out here the deposition of the cholesterol, which is a metabolic disorder, which leads to atherosclerosis. And this entity is mentioned by Vagbata as Kapanubandhi Vatajarudra. Due to the obstruction, there is an infarct. Due to the infarct, the Dhatu Sangatan, that is Sira and Mansa Dhatu, that gets Vidirna. The term Vidirna means that particular cells, due to the rupture, the sira and maus dhatu gets vidirna. So, due to the vidirnata or due to the infarct, there is a vrana nirmiti, fresh wound, vrana nirmiti. Suvarna is having the vranagna property. So I want to take the advantage of this property of Suvarna. Due to the infarct, the blood vessel gets ruptured. There is a blood clot. I want to rub out, I want to clean that clot, the Lekhan property of Suvarna. Number of you people are not aware. Suvarna is a rasayan and Suvarna at the same time Lekhan also. There is no any classical explanation in which matra, which dose Suvarna acts as a Lekhan, or how long we use the Suvarna so it will show its Lekhan property. No classical narration available in any Sanhitas, any Rashastra books. This you have to your own decide it when Suvarna will start working, showing its property as a Lekhan. So the clot formed there due to the infarct, due to the coronary rupture, the Lekhan property of the Suvarna will help me to remove that blood clot. In order to speed up the process of collateral circulation, regeneration of the dead or necrosed cell, ojo dhatu vivardhana, snigdha madhura rudya property of Suvarna will help me to regenerate the dead tissue. I think the justification of selection of the Suvarna in the management of the post-myocardial infarction as a rasayan dravya, this concept in your mind gets cleared now. The next ingredient of this Suvarna Arjun Prash is Arjun. You all are aware, due to its prabhav, Arjun is a Rudya. Kakubaha Shitalo Rudyaha. Kakuba means Arjun. I underline the property Kshata, Shaya, Visashrajika. Med Meh Vranan, Hanti, Tuvaraha Kapapittakru. Tuvara means Kashayaras, Kapapittakru. Post MI, now your concept is clear, there is a infarct. Your concept is clear that Dhatu Sangatan, Sira and Maus Dhatu, they gets Vidirna. That means there is a Kshata. The reference of the properties of Arjuna is giving you the advantage to use the Arjuna in Kshata. Nothing I am talking from my pocket. I am just quoting you the references, the properties of Arjuna, which will help me in treating the Vidirna or Kshatra. So now your concept is clear. The recent Vrana, the recent infarct, you can use Arjun. The in the management of prevention of secondary atherosclerosis, once your body develops the tendency of depositing the cholesterol, you are aware the heart and its coronary network, the left coronary, right coronary artery and its branches. Once the deposition happened, there may be a chance of another coronaries may get affected or may get the atherosclerotic changes. So the property, Medhagna property of Arjun will help me in the management of secondary atherosclerotic changes in the coronaries. The Vishasrachita property of the Arjuna, the term Visha, here I am pointing out towards the Sanchiti of the arm, accumulation of the arm, that is to understand the deposition of the cholesterol in coronaries. So this property of Arjun will help me to nourish the heart and its wall, capillaries and arteries, its ability to remove the milieu from the coronaries and keep them healthy. The Rudya property of Arjuna will help me. That was my assumption, or that was my hypothesis. Why I selected Suvarna, why I selected Arjun. Now, the next ingredient in the combination Suvarna Arjun Prash is Acorus calamus. Vacha, in Marathi you can say Vekhanda, in Gujarati you can say Godavach, Latin name is Acorus calamus. You are aware Ushna and Tikshna property of Acorus calamus will help me in Dipana, Pachana and Vatahara, Kaphavata Shaman. You are aware that Acorus calamus is having a Lekhana property. The accumulation there of the cholesterol the Ushna Tikshna property, Katu Tikshna, Ushna property, Rasavirya and Vipak there. That will help me in order to digest or the pachan of the accumulated cholesterol, or you can say the arm in the coronaries. So it will help me to remove the marga over it. The Vedana Sthapana property, Shula Nuta. This is from the Dhanvantari Nigantu, the shlok I quoted here for your reference. And due to the marga avarod, there is a chest pain, you are aware. In post myocardial infarction, see, we are studying this medicine in two parts, before MI and after MI. If there is a family history of hyperlipidemia, there is a history of myocardial infarction, there is a history of the other associated factor, obesity, hyperlipidemia, then non-veg diet, alcohol, smoking, all these risk factors. In order to prevent the myocardial infarction, you can give Suvarnarjun Prash, and post-MI, also you can use the Suvarnarjun Prash as a Rasayan Chikitsa. Initially, as a preventive, post-MI as a Rasayan Chikitsa. In order to prohibit and protect from atherosclerosis, the drug selected here is Vacha, that is Acorus calamus. Next ingredient here is honey or shahad, or you can say madhu. I underline the property why I selected the honey as one of the ingredient in order to make the auleha base. Vilekhan, the property of the lekhan property of the honey. No more explanation, I think you will require about the role of lekhan. Here, the lekhan property of the honey in post-MI will helpful me to whatever the clot formed there due to the rupture of the arteries there. I want to remove that block. So the property of the honey lekhan will be helpful to me. Vranashodhan and Vranaropan. See, this is the exclusive property of the honey. I pointed out toward that there is a sanclay, that is the good environment, no oxygen supply, no fresh blood supply to that necrosed part. So what Charka says? Charka says that is the best environment to develop the krumi there, and he used the term sanclay. So the Vrana Shodhan at the same time Vranaropan. Old myocardial infarction, healed rupture. This property of honey, Shodhan and Ropan, definitely having an advantage to repair the fresh rupture there. That is vidirnata. The term rupture you understand very nicely. But the terminology used by Charaka, vidirna, that is very difficult to digest. Charaka was aware. Our acharyas were aware about the vidirnata, about the sankled, about the environment. The infected part, you are aware, no blood supply, no oxygen supply, that particular part of the myocardium. Because the heart is continuously contract and relax due to the lack of this supply, that dead portion is not contracting or relaxing properly, and that you can understand very nicely by reading the electrocardiogram. You diagnose there is an infarction. With the diagnostic tools, electrocardiogram, in the era of the Charaka, there was no such instruments were available. But the meaning of the terminology, why Charaka not use the word clade? Why very precisely he used the term sankled? Had you think ever what is the difference between clade and sankled? This is the intention of our this diploma in cardiology session. The meaning between the lines, how to understand the cardiology. See, to understand the Krumija Rudro as a student, I'm talking somewhere 42 years before. That was not easily digestible for me. But when I studied, when I get the proper guidance from my gurus, then one by one my concepts gets clear. So the property of the honey, vrana shodhan and vrana ropan. Sukshma sroto vishodhanam. The small sukshma, small minute micro capillaries. Here I want to point out, by reading the ECG, many times the small capillaries had in fact number of the times but not documented on the ECG. But Charaka documented. Charaka says, Sukshma param sroto vishodhanam. This is the property of the honey, and you should avail these properties of the honey to overcome the circulation in the micro capillaries. When this circulation boosts, the dead portion, the necrosed portion, or the vidirna portion, it will get the nourishment. Collateral circulation will develop there. This development of the collateral should be as fast in order to regenerate the dead portion. So the Yogavahi property of the honey will help you to very fastly develop the coronaries, develop the collateral circulation. The Medagna property of the honey, you all are aware, honey is having a very good wound repairing property. So you can use honey in Kshata, that is in fresh myocardial infarction. So these are the ingredients selected in the Suvarna Arjun Prash as a Rasayan Chikissa. Now come to the point. This is the nuclear scan study. This is stress myocardial percussion there. Nuclear techniques are currently available to demonstrate the extent and distribution of viable myocardium, localized areas of ischemia induced by exercise or by drugs, and recent myocardial cell damage. See the black portion, the black portion in the above 3 and below 3 oval circle there in ovals. That dark black portion is indicating towards the part of myocardium which is not getting the sufficient blood supply. Post myocardial infarction, we started here the Suvarna Arjun Prash 10 drops on empty stomach after 8 months. Listen to me properly. The dose 10 drops added to the half cup of water on empty stomach for 8 months. Look at the slides below. These 3 slides showing you the black parts which is not getting, that is infarcted part, not getting the blood supply, nourishment there. And after the 8 months, look at the above 3 slides, and that portion is giving you the knowledge of regeneration. This particular part now rejuvenated, nourished, getting fresh blood supply, oxygen supply, and contraction and relax. The movement of the heart wall is now normal here. Now I'm trying to give you the conclusion of the Rasayan therapy. you are aware about the modern treatment in ICU in post-myocardial infarction, anticoagulant therapy in acute stage of infarction, originally hoped that anticoagulants might limit the thrombotic process and it will minimize the myocardial damage. आप सभी को ये पता है. In practice, the benefit conventionally demonstrated, there is a reduction in thromboembolic complication such as pulmonary embolism. Dear friends, definitely I will put light when I will teach you in detail in our course here. The use of heparin, warfarin, thrombolytic enzymes are the attempt to lyse intracoronary thrombus. The intravenous streptokinase apparently produces a slight reduction in mortality from myocardial infarction. But the fatal hemorrhage due to this streptokinase, nowadays use of tissue type of plasminogen activators, this limits the fatal hemorrhage. This Rasayan Chikitsa, Suvarna Arjun Prash, over the last 32 years in my practice, shows 60% results, and that result in recanalization, regeneration of the necrosed myocardium. The Suvarna Arjun Prash boosts the procedure of collateral circulation after the 8 months. So in this way, you can take the advantage to overcome the second episode of myocardial infarction, and due to the use of the Suvarna Arjun Prash for this longer period, nullified the second episode of MI at great extent. So, this artery cleansing therapy, I am pointing out towards the use of Suvarna Arjun Prash throughout the remaining life of coronary heart disease victims, will provide good nourishment to the heart muscles due to the clean network of the blood supply. The Rasayan properties of the Suvarna Arjun and Arjun blows the new life in necrosed muscle, and this is the achievement of Rasayan Chikitsa. There is a failure also. what I pointed out, in 60% of the patients, we got these type of results. The failure is due to the smokers, alcoholic, diabetic, and last but not least important is hypertension. During these 8 months of course, no statin group of medicines given throughout the course. So this is all about the today's presentation. Definitely, this is a very, you can say, a you as a you are a Ayurvedic graduate, doctors, Vaidyas, you can benefit your post-MI patient. You can benefit as a preventive in those there is a strong history of hyperlipidemia. There is a strong history in family of myocardial infarction, hypertensive. So preventive and post as a rasayan chikitsa, you can choose the Suvarna Arjun Prash as a rasayan chikitsa and as a preventive measure also. Thank you, madam. I am handing over to you. If anybody is having any queries, they can ask me.
Thank you so much, sir. It was indeed a very insightful discussion and seminar, webinar, I would say. So, before we take up the questions, there are two questions. I would like to give you all a reminder of the course. So, just I will share the brochure of the Diploma in Cardiology course. Sir, I will just stop sharing the screen. So, just to give you a glimpse of the Diploma in Cardiology, Ayurveda Cardiology course, it's a 6 months online training program for BAMS doctors. And I will give you an overview why this course. So, comprehensive cardiac training, diagnostic integration skills will be taught, classical protocol mastery, and expert faculty guidance, of course, it will be there. And also, it's a certified course. So, course syllabus: Ayurvedic management of cardiac conditions, hypertension management, cardiac arrhythmias and conduction disorders, cardiac investigations, and its Ayurvedic correlation, classic Ayurveda Hridroga understanding, drug selection and classical formulations, therapeutic approaches, emergency and ICU management, specialized clinical topics, lifestyle and risk management factor, preventive cardiology, integrated and specialized topics, and of course, classical references. So we have Sir as the mentor for the whole of the course, and you may ask your doubts during the live session. Also, the post-course support will also be provided. So you will be expertising in all of these. So hypertension, IHD, so anomalies, heart anomalies, vascular disorders, and also you'll be getting to know about ECG, reading analysis, etc. So course features includes comprehensive training in Ayurvedic cardiac disorder management, ECG interpretation, Panchakarma protocols that are specific to Hridroga, and classical formulations that are specifically used, and university certification. So, without delay, kindly contact Ayurveda Map and make sure that you enroll for this golden opportunity and you can be an Ayurvedic cardiologist. So thank you. So there are a few questions. We will take up the discussion. Participants, now the session is open for discussion. You may also unmute yourself and ask your doubts regarding today's topic directly to sir. So there are two questions. Dr. Ujjwala, in old MI, will it be beneficial?
This will give you the fresh, you can say, recent MI as a Rasayan Chikitsa. In number of patients we are in our day-to-day practice we are giving. As far as the old MI is concerned, madam, I had given you the one line answer in that. Once your body develops the tendency of depositing the cholesterol anywhere in your body. Today, our topic is dedicated to the heart. So we are dealing here with coronary arteries. So in old MI, that old MI is only due to the coronary blockages there. This can happen in because this is a metabolic disorder. Continuously, this procedure is going on. So the milieu or the kachra or the debris, these can accumulate in other coronaries or in same coronary also. So in order to prevent the secondary blockages there, second episode of blockages there, in old MI patient also, you can use the Suvarna Arjun brush.
Thank you, sir. Hope your question has been answered, doctor. Next question, Dr. Ramya K. For hyperlipidemia, also this can be given.
Yeah. That is clearly mentioned in my lecture. That is in the individual having a tendency, family history of hyperlipidemia. As a preventive measure, you can start with Suvarna Arjun brush.
Next question, Dr. Aman. Is ejection fraction can be increased after treatment?
Yes, Aman, this is very, you can say, when the particular dead part or the necrosed tissue, when the circulation, the nourishment that happens there, definitely the ejection fraction improves. This is your a very rightly you pointed out, and when the contraction and relaxation due to the collaterals, or you can say the regenerating the Rasayan Chikitsa that results in increased or improvement in ejection fraction.
Thank you, sir. Next question, Dr. Pragatishwari. Can we give this medicine in?
Yeah. Dr. Pragateshwari, this is only a 10 drops. And I think, doctor, you have to make yourself clear that 10 drops of honey, I don't think that is boost the glucose level. That is also a very controversial topic. That is, honey is responsible for uh, blood sugar level, or so that only 10 drops, that is not more than 2 ml. Not, I don't think 2 ml, 1 ml solution is there. So whatever you are taking, the jawar, bajra, gehu, that is the wheat, rice, beetroot, then any fruit, they are also having the glucose there.
Right.
So 10 drop of honey, I don't think that will disturb your diabetic or sugar level there.
Next one, Dr. Aman. Patient with heart failure having ejection fraction less than 20%, can it work?
That is depend on doctor why which cause is responsible for heart failure. There are number of the causes for heart failure. If this heart failure is post MI, then you can try it, the Suvarna Arjun Prash, because there is no any specific medicine in modern science also for this.
Thank you, sir. Any further questions from the participants? Okay.
Actually, 1 minute, madam.
Yes, sir.
Actually, Aman, that I never advocated for heart failure. My topic today is post-MI. My topic was not heart failure, but just you put your query. Just I am giving you, you can try it.
Thank you, sir. Next question.
Varsha,
Varsha.
Varsha.
Dose duration.
I told you that 10 drops with half cup of water on empty stomach. Dose I had given, time I had mentioned, duration, the result which I put here for 8 months, and at the same time, the Rasayan Chikitsa, how it works. I told you that throughout the life, you can use. But my concern, which I earlier mentioned, that I focused on the Rasayan property of the Suvarna. If longer use in higher doses, then whether that will turn into the Lekhan property. Aggressively, I'm talking here about. So what I mentioned there, that no proper indication is given when the Suvarna is working as a Rasayan and when the Suvarna is working as a Lekhan. So what we do, we taper down the dose, and from 10 drops, we reduce to 6 drops for a longer period. Which company is making? No, I don't have any idea about that, but formulation I had given to you. You can prepare, or if you have a good friend who is master in MD Rashastra, you can go and approach to your friend and you prepare your own.
Thank you, sir. I think which company is making it?
No. You have to prepare your own. Can we handle emergency in cardiac disease after this course? Definitely, this will be a guideline how we are handling the patients. If anybody really from your batch interested in doing the cardiac practice from the Ayurvedic perspective, they can request to the organizer. They can refer the particular candidate as a, you can say, a practical training in my clinic. For that, we are not charging anything. You can come down. You can see how we are handling the patients, and you can become more expertise, because the cardiology is not a, you can say, a very short topic. That is a very huge topic. Every day also we have to, after 35 years also, we have to learn, because number of new diagnostic procedures are coming, number of the new drugs and molecules are also coming. So you have to update yourself. But from my side, I can tell you, for practical training, you can approach to administrator, and as per their guidance, we can entertain you.
Thank you, sir. I think next question, Dr. Aman sir, there is lot of patients goes under heart failure due to late presentation of MI. After revascularization, they are suffering with breathing difficulties and more symptoms. Is there a question? Okay, or just a statement?
What the thing he want to know from my side, he put the fact. This is the fact. number of the patients that landed into the
Breathing
after
difficulty.
the vascularization, suffering with breathing and difficulties.
Okay, it's
So
a question. What can we do in this? So
what can that is a very vast topic, madam. You have to join the course. During the course, I will
correct,
guide you. Definitely, because number of the if and buts are there, so that in that condition, in a one single line, I can't tell you.
correct. Yeah. All right.
जब मैं पढ़ाऊंगा तब मैं धीमे धीमे बात आपसे करते ही रहूंगा कि दीज आर द लिमिटेशंस एंड यू कैन handle the patients with Ayurvedic medicine and management. So, abruptly, I cannot reply to your question.
Or sir. Thank you, sir. Okay. Suppose
Bhavini, yes, I am visiting Baroda, Surat, and you can ask me for Ahmedabad also. My hometown is Ahmedabad, and I belongs to Ahmedabad only. So you can contact me.
thank you, sir. And though participants, those are asking for the course structure and fee, please contact Ayurveda Map WhatsApp number for
Hmm.
more details.
Hmm.
And okay, Dr. VJ in TVD can Swarna Arjun Prash cure?
What you are talking about triple vessel disease, doctor, you have to consider number of the facts. Number one, whether the patient is having comorbidity of diabetic mellitus, thyrotoxicosis, obesity, hyperlipidemia, then any strong family history. Then you have to consider the other comorbidity in triple vessel. When you are talking about triple vessel disease, definitely there is some strong factor is there. Non-veg diet, smoking, obesity. So you have to consider, you cannot on singly, you can rely on Suvarna Arjun Prize. Some other management also required to take care of triple vessel disease.
Your question has been answered, doctor. Okay, thank you, sir. Thank you, sir. All right. Kindly give your feedback, dear participants, regarding today's uh, session. You all right? Okay. Anybody wants to unmute yourself and ask any doubts? Dr. Surya Prakash, I think you're unmuted. Do you have any doubt? Okay. Any more questions from the participants? Also, once more, I would like to remind you all regarding the diploma course. It's a 6 months course, a certified course in Ayurveda cardiology. So, those who are interested in specializing in Ayurveda cardiology, the diagnostic part, the treatment part, both the modern as well as the Ayurveda part, and want to know more about the formulations and how different cardiac pathologies are considered and treated in Ayurveda, and want to know the approach from the cardiology expert, sir himself. So, kindly join the course as soon as possible. Tell your friends and colleagues and BMS doctors about this course. Thank you so much, sir. Thank you for joining today, and it was really very insightful. We look forward for the classes in the cardiology course from you. And thank you all participants. For any other doubts and clarifications, kindly contact Ayurveda Map, the WhatsApp group. You may send a message. You may also contact through phone. Thank you so much, sir, and thank you all participants. On behalf of Dr. Jasul as well, I would like to thank you all and see you all in the next session of cardiology as well as the upcoming sessions of Ayurveda Map. Until then, signing off. Shubharatri, everyone. Thank you, sir.
Thank you very much.